Others are worried that Israel will in fact double down on Gaza, with dire implications for civilians on the ground. Well, I spoke to Joseph Belliveau, the Executive Director of MedGlobal, a humanitarian non-governmental organisation providing emergency response and health programmes around the world, including in Gaza. And I asked about the situation facing medical workers in the north of the Strip.
MedGlobal has about 300 medical workers in Gaza right now, running a number of different health outposts, nutritional sites, and supporting hospitals. But the conditions under which they're working are extreme. It's hard to continue to find words to describe how horrible the situation is. Just a few days ago, my MedGlobal colleague, Dr. Abu Safyia, was hit in an airstrike on Kamal Adwan Hospital in northern Gaza. He, as the hospital director, of course, was in charge of a huge number of staff and trying to treat patients under such violent and extreme conditions. And then he himself gets struck. He had severe bleeding, had to undergo surgery himself. Luckily, now he's in a stable condition. But I've just now learned, just a few hours ago, that we lost, tragically, another colleague, a medical worker from Kamal Adwan Hospital, was hit in a strike just a few hours ago today, and died from his injuries. So again, it's just almost impossible to describe how horrible, almost minute by minute, the conditions are. And I can describe the day before Dr. Abu Safyia was hit in that airstrike. He wrote a message to me and other colleagues at MedGlobal. And he said, look, I want you to understand how severe and horrible this is. And he described the situation of a helicopter gunship attacking the emergency ward of Kamal Adwan Hospital. 4 staff members and several patients were injured in that strike. And then as others came in to try to help the injured, 2 more medical staff were critically wounded and are still in the ICU in that hospital at this moment. So just to give you a sense of how violent and awful the circumstances are.
Joseph, let me first just express my condolences for the loss of your colleague. Have you been able to speak to Israeli authorities about these incidents? And how do they respond? Do they promise investigations? Do they take responsibility for what's happened?
Unfortunately, we get very little. Of course, we speak to the Israeli authorities all the time, but the pattern that we're living in right now is unfortunately nothing new. It seems to just compound and almost get worse and worse. But we're 400 days into this conflict now, and the pattern of egregious and consistent violent attacks against not only civilians, but against medical workers and medical facilities, explicitly prohibited under IHL, under international humanitarian law.
Joseph, I do just briefly want to ask, are there any humanitarian corridors open right now to get staff in or to get aid in or medical supplies?
There are, amongst the various entry points into Gaza, some of them are open some of the time, but it's extremely difficult to go through the administrative procedures and hurdles to get anything in. And then, as you well know, once things do get in, the situation of looting, it's become so chaotic and so violent inside of Gaza that even if you are able to get some of the few medicines and essential items in, it's very difficult to get them distributed to where they need to be. It's a fraction right now. We're talking 10 to 15% perhaps of what's needed in humanitarian aid is actually getting through those points right now.
Joseph Belliveau there from MedGlobal.